Good evening, everyone, and thank you for joining us again tonight. Before we get started, I would like to read the brief disclaimer that you see on your screen. And the disclaimer is this: the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to introduce myself. My name is Craig Orapello, and I will be your host for tonight's program. And as mentioned earlier, welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. The PharmAssist program takes place every Monday evening at 7 p.m. Eastern Standard Time. So thank you for checking us out, considering that the clock's changed and everyone's a little bit thrown off today. So we appreciate you being here tonight. As always, we will be providing a live medication instructional program on 3 fertility products, including an interactive Q&A throughout the program. And how is it interactive? Well, that is where you come in. You can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, either in the Q&A or directly into the chat. We are joined by amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from the nurse in their clinic. And today we are joined by Laurel Meier. So I want to thank you again for your time and interest this evening. And I now want to turn it over to Laurel. Laurel, take it away.
Okay, thanks, Craig. Hi, I'm Laurel Meier. I'm an IVF case manager in California. And tonight we're going to be reviewing 3 medications: Menipure, the Gonolife Pen, and the Sonara Patch. So there'll be a question and answer period after each video. And I encourage you to write in your questions, because any question you have, someone else is going to have it too, and they're going to benefit from it. Please focus your questions on how the medications work, the side effects, the purpose, and then direct your questions, your clinical questions like dosing and timing, back to your IVF case manager at your clinic. So these videos are always available afterwards from the PharmAssist program, including tonight's. They're always available at mymandelsPharmacy.com, Mandel's Facebook page, and on YouTube. So to get started, I'd like to share a story of how I became interested in becoming an IVF case manager. About 25 years ago, my husband and I started having difficulty getting pregnant. So the first step was several rounds of Clomid. We did that without success. Next stop, we tried IVF. We did a couple of rounds of IVF, and unfortunately without success as well. We were still reeling from the news of the last IVF cycle not working when we got a call from a friend of ours who was a labor and delivery nurse. Her patient had just delivered a baby girl, and she wanted to find parents for her baby. My friend told her about my husband and I and our desire to adopt, and she wanted to meet us. So we went down to the hospital, and we met her and her baby, and we talked, and she decided she wanted us to be her baby's parents. So the next day, we went down to the hospital, and we brought our new little baby girl home. And it just so happened that it was Valentine's Day. So we were thrilled. And then 4 years later, we wanted to expand our family. And we were the happy recipients of a frozen embryo. I went through a frozen embryo transfer cycle, and then an adopted or a donated embryo was transferred into my uterus, and I got pregnant and had a second baby daughter, and she was born on the 4th of July. So now we have 2 holiday babies, and my daughters are now 16 and 21. So here's a picture of them. That's Sydney and Megan, all grown up. And the reason that I tell this story is because I know how hard this process is personally, and I want to make it a little bit easier for you. I know that it's daunting and it's stressful, but I want you to know that you're not alone. There's thousands of couples right now going through the infertility process, and I encourage you to reach out to friends, family, and other couples going through their infertility journey and share your story and hear theirs. And it can definitely offer you some support. I also, the reason I decided to get involved in the Mandel's PharmAssist program is because of my own personal journey. And I want to be able to share my knowledge with you and hopefully help make your journey just a little bit easier. So I encourage you to just take this one step at a time. Keep the faith. And I know you can get through this, and I know you can build your family. So if you'd like to hear my fertility story in all of its gory and glorious detail, you can do that. It's about a 20-minute story because I just told the very short version. It's available at the My Mandel's website. And also, if you wanted to search on YouTube, you can put in my, Behind the Shots, Laurel's story, and you can find it there. So tonight, my goal is to help you gain the courage and confidence to give yourself your shots. And I know that very soon you're going to feel like a pro. So Craig, you can go ahead and start the first video on Menipure. Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menipure. Menipure comes in little powders, and we're going to use our imagination, and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menipure. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menipure. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menipure and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. All right. So after that, seeing that, hopefully you'll put in your questions, and I'll answer them live. Craig, any questions?
I should probably unmute first. Sorry about that. We do have some questions coming in, and just a quick reminder, if you're joining us via Facebook, you can put them directly into the chat. And if you're joining us via the Zoom, you can put it into the Q&A or the chat. Either one of them, we'll get a hold of those questions for you. So the first question coming in says, is there a danger if I find a bubble in the vial while mixing my Menipure? Do I need to get rid of those before I inject myself?
Okay, so while you're mixing the Menipure and it's still in the vial, there's no concern about bubbles. However, once you get the Menipure back into the syringe, if you have a large bubble at the bottom, you're going to want to click with a pen and get that air to rise to the surface. The mini bubbles you can completely ignore, okay? And then you're just going to twist that off, and you're going to twist the needle on. Now you need to get rid of the large amount of air, of course. So you'll just push until you see a drip of liquid at the tip, and then you're ready to give it. So that's all there is to that.
Perfect. Thank you. I know sometimes people get a little bit nervous about the air bubble specifically, because we've all seen movies or some TV shows where, you know, they make it seem like it's more dangerous, obviously, than it really is. So that's great to be able to put that to rest so people can feel comfortable with regards to that. And so another question that came up so this one has to do a little bit more. I know with Menipure, it's a little bit different because of the fact that people are mixing multiple different vials together into one, depending on the number of vials that they're going to be taking. And so just the question just comes in, and it's pretty easy one, but it's just in order to know the exact dosage of the injection medication, I'm going to find that out from my fertility doctor, correct?
Correct. Yes. You're going to know, they're going to tell you if you're taking 75 units, which is 1 powder mixed with 1 milliliter of fluid, or if it's 150 units, that would be 2 powders, 225 units, 3 powders, etc. And they'll let you know how many powders it is, so you really don't have to do the math. But they'll let you know, and you can always mix those powders so that you're only giving 1 shot.
I think that's the key part at the end there, right? Is that people feel like, oh, it's multiple different powders that you're mixing, but you are mixing them all into that single shot to make sure that you're giving yourself 1 injection, just mixing all the powders in at once. So that's a great question. Thank you very much for reaching out with that. So this question comes in just a little bit as we talk on this program. We go through a lot of different products, and we kind of try to give an overview of all the key products that people are using. And so sometimes there are different versions of different types of potential medications, and they can be a little bit confusing, or you hear about a friend that's doing something different than you, and you want to kind of make sure that, you know, what's going on? Why am I doing this versus that? So the question comes in, a friend of mine is taking FSH alone, yet I'm on Menipure. Can you please explain just a bit more about why or how Menipure is different than an FSH injection alone?
That's an excellent question. So Menipure is a combination of follicle stimulating hormone, or FSH, and luteinizing hormone, or LH. And the two hormones work together to stimulate the ovaries to produce the multiple follicles. So if Menipure is being used for an intrauterine insemination, the goal is to get 1 or 2 follicles to maturity. So that's, you can use it for either IVF or intrauterine insemination. Using FSH alone works for some patients as well, because the body makes its own luteinizing hormone. So there's enough in your system, in your bloodstream, so that using FSH alone, you can have a successful IVF cycle. Now, the other group of folks don't make enough LH, so they need to have the Menipure, which has both the FSH and LH. And it's very common for doctors to prescribe both an FSH-only medication like Gonolife or Follistim in combination with Menipure, which is that combination medication, in order to have enough of those two important hormones in order to have a successful IVF cycle. So that was a really excellent question. The bottom line is to just refer back to your provider, and they will let you know what's best for you.
Great. Thank you so much. I think these are, sometimes we'll see people ask questions and they'll have follow-up questions based on some of those. So it's great to be able to kind of build that story in your head, whatever your questions are, that we can answer them now. The goal of PharmAssist is for you to be able to ask those questions now so you feel comfortable later and you're not worried at the time where you're giving the first injection. You've already gotten all the questions out of the way, and now it's just a matter of, giving that injection and getting started. So and with that being said, I do want to just give one quick shout out to Brianna, who has some great questions, and also followed up by saying, I apologize if I'm going to ask a lot. This is overwhelming. And just want to let you know that's 100% what this program is about, is we want to provide multiple opportunities. So you can obviously reach out to your clinic and speak to your nurse. You can reach out directly to the pharmacy, and that's what we're here for as well. And then PharmAssist is kind of that merging of both of those to bring them all together so you can ask as many questions as you want and get them taken care of, such as this one, a follow-up question she asked that said, and this is a great question because it comes up all the time as well, how many days of injections are we typically expecting to be giving ourselves?
Yeah, good question. So everyone's a little bit different. The typical number of days is between 10 and 12. And what will happen is you'll continue to take the daily injection, and then you'll be monitored. So you'll have your vaginal ultrasounds every few days, and your follicles will be growing. And then once your follicles reach the mature state, which is when most of the follicles are between 16 and 18 millimeters in diameter, so they're the size of small grapes, that's when you'll take your last Menipure shot. And then you'll take your trigger shot, and that'll be your last shot before your egg retrieval. Good question.
That's actually great that you got a chance to kind of add in a couple of other products in there, because this question that just came in and I'll just kind of prepare you also, Laurel, up in advance, and by letting everyone know, to recap what Laurel said earlier, some questions are going to be a little bit too specific that we won't be able to answer here. Or at least not have a definitive answer. We can kind of guide you in the right direction, but they're going to be questions that you're going to need to speak to your HCP, speak to your nurse, reach out to your clinic and ask a little bit more. This is more for kind of general overall questions, but this is a great question just because we talk about so many different medications, and there are many more medications than what we're going to talk about tonight. Laurel, just if you want to touch on this very briefly, but this question came in saying, I do not have this medication in my fertility plan. I'm assuming what I have been prescribed is okay. It's Gonolife, it's HCG, and Ganirelix. And so just to throw it out there for you to be able to say, yes, we know that we're not going to talk about all these products, but just wanted to get to everyone's question that's coming in tonight.
Right. Okay, great question. So we are going to talk about Gonolife in a little bit. And yes, some patients will have just the purified FSH and no Menipure. So you're one of those people that doesn't need extra LH because you make enough of it on your own. So you don't have to worry about taking Menipure. So that's a great question.
Great. Now I like sometimes we kind of try to combine it all into one and try to get to everything. And so keep the questions coming, especially even if they don't feel like they're directly related to what we're talking about. There's always some tangential connection that we can touch on. And while we have Laurel here tonight perfect time to ask these questions. So thanks for bringing those up. Let's see, I'm looking. Okay, so this question just came in. It says, I think I may have counted wrong. Oh no, what do I do if I accidentally mixed an extra Menipure into my vial? Speaking of the multiple vials that we talked about earlier.
Yes. Okay. So this is a new process for all of you. And I just want to reassure you that if you make a mistake, you're not the first person that's done this, and it's okay. 99.9% of the time, everything's going to be fine, and we're going to be able to correct any kind of error. So what I would recommend, if you mix too many Menipure powders into your vial, is put that mixture in your vial. Just put it in a vial and put it in the refrigerator. Then you're going to start with a whole new set of what you need, supplies. You're going to mix the appropriate number of Menipure, and you're going to give your shot. Then you're going to call your clinic, and you're going to tell them what you did, and you're going to say, you know, I've got this mixture in my refrigerator. And what they're going to do is they're going to be able to tell you how much of that mixture to take and when to take it so that it's not wasted. So that's an excellent question. Back to you, Craig.
Perfect. Well, it does look, excuse me, something is definitely caught in my throat. I got a tickle tonight. So it does look like as of right now, we are caught up. But what we always like to do is we want to give people a little bit extra time in case maybe that question sparked a question for you. And so what we'll do is give another 30 seconds or so for people to put in that question if they have one. In the meantime, I will throw it back over to you, Laurel, if there's anything else you wanted to share, anything you wanted to add to a previous answer, anything like that, as we get ready to move on to our second product tonight.
Okay. Well, I know that a lot of people do ask, what are the side effects of Menipure? And Menipure is obviously a stimulation medication. Its job is to help your ovaries produce multiple follicles and multiple eggs, and that means that your ovaries get a little swollen. And that swelling, think about the size of a walnut, and they can get a little bigger than that, and they get heavy and they hang on the ligament that supports them in the pelvis. So what you're going to experience, likely, it's a common side effect, is a heaviness, like you're carrying a couple of rocks around in your pelvis. So that's very common. And if you feel that, there is nothing wrong. It's just the par for the course. Other side effects that you might experience and that are expected are some moodiness and fatigue. That's very common. You can have bruising at the injection site, and you can have pain with this shot. Now, to ease the pain of the Menipure, you can use a numbing agent like an Emla cream. You can use Sonara Patch, which I'm going to talk about in a little bit. And you can also give this medication extremely slowly. This is the one that does tend to sting more than the others. So I do recommend that you give it as slow as you can, and that's going to ease the stinging. You can also ice the site prior, and that does help. So I just wanted to make sure that I mentioned those side effects so you know what to expect and you don't get surprised. So back to you, Craig.
Perfect. So it does look like we are all caught up with questions as of right now. So I think we're ready to move on to the next product. And obviously, as we mentioned before, do not worry if you think of a question as related to Menipure later on, you can always tie it in. We'll have plenty of time at the end too to also answer any questions that you think of throughout the course of the program. But in the meantime, we can get ready to throw it over to the product number 2 for tonight.
Okay. Product number 2 is the Gonolife Pen, and it looks like that. And I'll see you after the video. Hi, my name is Laurel, and today I'm going to demonstrate how to use the Gonolife Pen. The Gonolife Pen is a really cool little pen here. It's super easy to use. All you have to do is dial your dose that the clinic has told you to take, and if you go too far, you can just dial it back. You can go back and forth. it's not going to hurt the pen. So just find your dose. A typical dose is 300 units. So that's what I'm going to demonstrate today. Not sure if you could see that very well, but there's 300 units. You take your needle, pull off the tab. There's a needle on this side, which goes in to access the medication. You twist it all the way on, and then you pull off the outer two caps. You find a spot in your tummy, anywhere in your tummy, as long as it's at least an inch away from the belly button. And you don't want to inject into a spot that already has a little bruise or any soreness or redness from a previous shot. You're going to find a spot in the belly that has some fatty tissue that you can squeeze. You're going to squeeze the belly, go straight in like a dart, let go of the squeeze, and inject the medication. It will click, 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 click until it's already all instilled. In the little window, you will see 0, and you'll know that you're done. So you wait 3 seconds, have a Kleenex handy, pull out, and hold your skin. If after about 10 to 15 seconds, your skin is dry, then you're done. If you do notice some medicine leaking out or some bleeding, which can happen, it's not something that is a problem, but you just need to hold your skin a little longer until it's dry. The pen now has a medication still left in it, so you don't want to throw that away. You want to take your large cap, slide it on there, twist it off. This part will go in the sharps container, and then the cap goes back on the pen, and you can put it back in the refrigerator for the following injection. And that's all there is to that. All right, questions. Please feel free to put any questions in the chat. Craig?
All right, let's see. So we have questions coming in. The first one is just about storage with medication. And so it says, so how do I store the pen between shots? And does this change if I'm traveling for work or for fun? Hopefully when we can all start traveling for fun again.
Yes, okay. So the Gonolife Pen it needs to be stored in the refrigerator between 37 and 46 degrees. So basically in the refrigerator, if you want it to stay good until the expiration date on the box. It can be stored at room temperature, which is considered 47 to 77 degrees. And then it's good for 3 months. And not until the expiration date. So we recommend keeping it in the refrigerator. Now, once you have punctured or taken the first shot from it and you've done the first puncture of that needle into it, then it's good for 28 days regardless of where you store it. So you can store it in the refrigerator or at room temperature below 77 degrees, and that's fine. Then it's good for 28 days. And I know you'll be done with it before then. Oh, travel. I almost forgot. So if you're traveling, we just recommend that you put it in an insulated bag with an ice pack to keep it cool. And you know you're going to use it up within 28 days, so it'll be fine.
Perfect. Sounds good. So now this next question comes in regarding, it's actually kind of a combo to the first 2 products that we talked about today. So the question says, if I am prescribed both Menipure and Gonolife, am I and I'm supposed to inject both, do I inject them one after another, or is there a time frame to do both injections separately?
Good question. So the timing of shots, those kind of questions really need to go back to your provider or your IVF case manager because each clinic's a little bit different. They may tell you to take the Gonolife in the morning and the Menipure at night, like 12 hours apart. They may have you take them one after the other at the same time every day. So really do go back to your clinic and ask that question.
Perfect. Yep. Yeah. Sometimes there are things, like we said, that we can give a little bit more specifics on, but typically when it comes to these types of things, and just you can always ask these questions and we will help wherever we can. But when it comes to timing of shots, that is one of the things after probably your actual dosage. Those are like the two things that are going to be most specifically relayed back to them for questions, just because there's reasons behind why they gave you, when they would do what they want to do. But hopefully, at least what we're here for is when to tell you what questions we can answer versus when to direct you back to your clinic. So hopefully that helps a little bit. Sounds good. And thank you. This is extremely helpful. You have no idea. Smiley face emoji, and that is from Brianna. So thank you very much, Brianna, and thank you, Laurel. You're helping quite a bit tonight. So that's great. The smiley face emoji really made our day there. That was awesome. Thank you.
Yay.
All right. So now we've talked about how to actually store it, all that kind of stuff. Now it comes down to if you make a mistake. And the question is, and we always get these questions, so feel free if you get nervous. We'd rather you ask the questions about mistakes now so you don't make them later. But the question is, what happens if I forget to give my shot of Gonolife altogether? What do I do?
Good question. Okay. So you're going to take your shot as soon as you remember. Then you're going to call your clinic and you're going to tell them, oh, I forgot to take my shot. I took it 3 hours late or whatever it was. And they're going to say, no problem. It's not going to ruin your cycle. I don't want you to worry about it. However, they're going to give you important information about what to do in the future and what time is your next shot. Okay. So just the most important thing is to communicate with your clinic. We all make mistakes and your clinic will be very understanding. They just want to make sure that you communicate with them so they can adjust any future doses to maximize your response.
Great. Thank you very much, Laurel. All right, let's see. We got a bunch coming in all at once. So I'm just trying to make sure I get to everybody. Okay. So this could be one that was sparked based on the questions earlier about Menipure, and says, how long can I plan to be on Gonolife roughly by the end of my cycle?
Yes, so that's the same amount. It's 10 to 12 days approximately. It could be a little bit less or a little bit more depending on your response to the medication. So as I said before, you are going to be monitored by a vaginal ultrasound. The clinic will be watching your follicle growth. And when it's time for your last shot, they'll let you know. And you'll take your trigger shot at a very specific time, which they will tell you what time that is. And then your egg retrieval will be the next thing that happens. Good question.
All right, let's see. Next question is, okay, so this is kind of a little bit along the lines of like the forgetting to take a shot or something like that. But when it comes towards the end of that pen, and this question comes in, you've answered it on this program a number of times as well. But what's the best way to handle a situation where I don't have enough medication left in my pen for the full shot?
Okay, good question. Okay, so if you look at the pen, you will see increments on the side, and you will see, and you'll be able to tell how much is left by looking at the plunger and the level of it. So if your plunger is way up here and you only have enough for a partial dose, you have two options. You can dial the pen to your prescribed dose, the one that doesn't have very much in it. You dial it to your prescribed dose and you give your shot. And you're going to push the plunger down. And when it stops, you're going to look at the window and you're going to see a number in there that's not 0. That's okay. You just take a new pen and you dial to that new number, you add a new needle, and you give yourself a second shot to complete the dose. That works great. Now, if you decide you don't want to give yourself 2 shots, and I can understand because no one really likes shots, you can save that pen that has a little bit in it, save it for the end of your cycle in case you need it, and start with a brand new pen. Dial your prescribed dose, give your shot, and you're done. So awesome question. Got 2 options there, and they both work really well.
Okay, so Laurel, I'm about to warn you in advance that this question does involve a little bit of math. So be prepared. just in case. I just want to let you know, because that is certainly one of the great things about the pen in the front end, that like you just mentioned, that you don't have to do the math because you dial it up and the number that's left is the number you have to inject. So you don't have to try to, you're not doing subtraction and try to figure out how much I gave and whatever. But this question is a little bit more specific. So we'll see we'll see. We said we were going to answer any questions that come, so I'll throw this out to you, and you see what we get out of this. So
Let's
here
give
we
it
go,
to me,
Jane.
Greg.
We got you ready, Jane. We have your question. Okay. If my plan is to inject 400 units every night, and I have 4 pens coming, 900 units each, right? Get ready. Will I get 2 doses out of each, and that will be a max of 8 days doses?
Okay, so you have 900 pens. You have 3 pens coming. Is that right?
4 pens.
4 pens. Oh, 4 pens. Yes. So you'll take 400 the first night, then 400 the second, and then you can switch to a new pen, and you can take 2 more days with your second pen and continue that way until you've got 8 days done. Then if you need to go more than 8 days, then you've got an issue. You've got a little bit of medication left in each pen. You've got the 100, the 400 plus the 400 is 800. Then you've got the extra 100. And then there's an extra 100 in every pen called the residual. So you really have 200 left on each pen. You can dial your dose on one of those pens, give yourself a shot. Whatever the number says when you're done is the remainder of your dose. And you will take another pen and you will dial it to that number and give yourself a second shot. If the dial still does not read 0, you may have to give yourself a third shot. But usually you can get an extra 100 out of every pen, so you should be able to get the 400 with just 2 shots. Hopefully it didn't confuse you even more.
That was amazing. I am impressed I was reading it, and you just, as soon as I read it, you had it all just immediately. You knew all the numbers, and I was like, all right, good. Well, she is handling this. This is great, and I don't have to do any math again, so this is perfect for me. But no, that's a great question. And yes, there's ways you can play around with it, and you kind of start to figure out what works best for you. Because obviously, like there's the way Laurel was just saying, where you use what you need and then move on to the next pen, and then you have a couple of pens with the overfill, the leftover, the residual in there, and then you can kind of combine that all together. You can obviously have just in those situations just give the remainder of that last pen, that for your next shot, and then pull out a new pen and give the rest of your shot. So there's like ways you can figure out what works best for you. But I will not lie that reading that, it took me back to feeling like I was taking like a math test back in the day, and it was like 2 trains are going, say, 2 different speeds, both heading towards St. Louis. Which one will get there first? I was like, whoa, okay, thank you, Laurel, you nailed it. That was great. And I think as of right now, it looks like we have wrapped up with all the questions for Gonolife. So as before, give another 30 seconds or so, just in case if people have more questions. And I will throw it back over to you as we get ready to move into our third and final product of the evening.
All right. Well, I don't really have anything extra to say about Gonolife except that it is purified FSH, so it's going to give you the same exact side effects as Menipure. Okay, so just be aware of that. Same exact stuff. So the next video we're going to watch is the Sonara Patch, and this is a really nifty patch that numbs your skin, so you will not feel the shot at all if you try this. All right, go ahead. Hi, my name is Laurel, and today I'm going to show you how to use the Sonara Patch. The Sonara Patch is used to numb the site before you give an injection. It can also be used for an IV start. It can be used for a lab draw. So whatever you need for, it numbs the skin. So what you're going to do is you're going to open up your package and pull out your patch. It's a combination of lidocaine and tetracaine. It is activated by heat, and it gets the medication into your skin using the heat. So what you're going to do is pull this back. The medication is in the middle, so you don't want to touch that part. You want to make sure that the place where you're putting the patch for your injection is clean and dry. And then you're going to place that right on the area where you want to give your shot. Make sure that you don't cover these holes because they do need to stay open to air to activate. And you're going to leave that patch on for 20 to 30 minutes prior to giving your shot. Once 20 to 30 minutes is done, you pull it off. You place your one-time use patch right on the cover, and you'll notice that it feels warm because once it's pulled off, that warmth activates it. And then you're ready to give your shot in that exact spot where you had your patch. And you probably won't even feel it. That's all there is to it. All right, the Sonara Patch. Any questions come in for that?
Yes, let's see. So we have a question coming in. It says, how loose must my clothes covering the patch be to ensure that the patch works correctly?
Okay, so the patch needs oxygen in order for the warming effect to work. It's an iron powder, so it just needs oxygen. So clothing isn't something that's going to hinder the process. If you can put your thumb in your waistband and slide your thumb back and forth, that's plenty loose enough. I just would recommend not wearing tight fitting jeans or any kind of like a body wrap, no cellophane or anything that's going to cover and keep oxygen from flowing. And that's it. Clothing is fine.
Yes, clothing is fine. And one of the things, it's happening again. Oh boy. One of the things is, yeah, people, when they say don't cover it, they tend to think that it means like, oh, I need to have it completely exposed. And it really is, you just don't want to, you just don't want to have like it's saran wrapped clothes so that you can't get any oxygen to it. So it's a great question and an even better answer. So thank you so much, Laurel.
Sure.
All right. So we have this question comes in that says, all right, so can I put the patch on after I give my shot if it hurts more than I expected, or if I have a specific injection site that hurts more than others, or is it only supposed to be used beforehand?
Oh, good question. Okay, so unfortunately, the Sonara Patch is only to be used prior to your injection. So if you forget to put the patch on and you give your shot and it hurts, that's the way it goes. I think what the best thing to do at that point would be to ice it or to use a heating pad on it afterwards, and that will help that pain go away. Then the next time you can use your Sonara Patch, and I recommend putting it on, setting an alarm for 30 minutes, and that way you're going to take it off and give it, and you won't feel it.
It's perfect, actually, the way that your answer, because it leads into the next question perfectly. Because you mentioned about setting the alarm for 30 minutes, and the question comes in: is it dangerous if I forget to take it off after 30 minutes? I don't want to overdose with the patch or anything like that.
Got it. Right. So overdosing on Sonara Patch is not an issue. They did do a study where they put 4 patches on for over an hour, and they measured the lidocaine concentration in the blood, and they found that it was still extremely low. So no problem there. However, it is recommended that it stays on for 20 to 30 minutes. So I do recommend that once you've placed it, that you set your alarm for 30 minutes. And that way you'll remember to take it off, remember to give your shot, and, no problems. Good question.
A lot of times anyway, the only real, if you leave it on too long, the bigger issue might be you just might get a little bit of local irritation just from having the patch stuck on for a little while, more than you would the issue of like, the overdosing on the medication, just because the fact that they tested it all the way up to putting on 4 times as many patches and put it on for like, 3 or 4 times longer. And so you can feel safe knowing it's a very safe product, and just set an alarm, take it off, and that's your reminder to give your shot. So that's a great question. So thank you very much. So now this question just came in. It says, I wasn't given this patch. I wish I did have it. I am worried that these shots are going to be a little bit more painful. Any idea on a level from 1 to 10, roughly, how much pain I can expect?
So that depends on your pain tolerance and depends on the medication. So Gonolife tends to not hurt very much. That's what most people will say. And they will also tell you that the Menipure stings a little bit more. So my recommendation would be, if you don't have a numbing cream or the Sonara Patch to numb the skin, is just use a little ice pack on your skin for about 60 seconds prior. And that will numb your skin a little bit. And then make sure you pinch the skin really hard before you put the needle in, and then give the shot extremely slowly. And that will help minimize the pain, and you shouldn't have issues.
Yeah, and also it's a lot of people get worried about like the needle and all of that. It's like the feeling that you're going to get is typically when the needle is first entering into your skin, and so that's the pinch that you get. So it's not typically, it's not going to be, you know, that you're feeling it the entire way as it's going in through your arm and things like that. So a lot of times you can kind of prepare for those subcutaneous shots being significantly easier to handle than some of the other products, and a lot of them are very, very low pain threshold. Obviously depends again on your personal threshold, but in terms of if there was like an aggregate of what that threshold would be, these are some of the products that we're talking about definitely on the lower end of the spectrum. And I know, Laurel, you had mentioned about using the ice before, like if you don't have the patch, using ice beforehand to kind of numb up the spot so that when you inject yourself.
Mm-hmm.
Question came in just saying, you had mentioned about ice and heat after the injection helping if there's like still residual pain. Is that something you would recommend too? Like for somebody, if they ice it beforehand and then give the shot, and then if there's still a little bit of pain, using ice or heat or one or the other, how would you recommend that?
Yeah, I would say ice prior, and afterwards you can try either one. It just depends on what works for you. So I would try heat afterwards. But if that doesn't seem to work, you can try ice and see if that works for you. But I would say with Menipure especially, you're going to want to give the shot very slowly because it does sting going in. That's the one that people do tend to complain about, and it can last for a few minutes. So yeah, ice it prior. You can also ask your clinic to order you the Sonara Patch if they haven't, and they'd be happy to do that. They can also order you a numbing cream. It's kind of a little bit more messy, but it works as well.
Those are a lot of great answers right there. A lot of good pro tips that you can use for when you're looking into ways to kind of get out ahead of it. And especially if this is your first time going through any of this stuff, we totally understand that more often than not, there's just those jitters beforehand that you just don't know what to expect. So you kind of want to try to be proactive with treating any potential side effect. And that's great. That's what this program is for, is to help you A, know what to expect, and B, know how to prepare for what you now can expect. And so really the program is there for you to be able to get these questions out and to really prepare yourself so you can know it's not going to be that bad. But in the cases where there might be any, even the smallest side effects, if it's something that you can, eliminate or alleviate by knowing about it in advance, then that's great. That's exactly what this program is all about. And speaking of all that, I just wanted to throw in that there was a response to your last answer that said, "Thank you, God." And this is in response to the pain thresholds. "Thank you, God. Great advice. I really appreciate it." So you're doing a great job, Laurel. All the information that you're sharing is really helping people out. So thank you.
Sure. Yeah.
A question comes in. Oh, okay. So this is more, I guess, a little bit more of a general question that I can jump on, and Laurel, you can also answer as well. But it says, regarding the PharmAssist program in general, do you discuss different medications every week? Should I tune in next week for other potential medications like a low dose or a Lupon trigger or Ganirelix? So that's a great question. And actually, yeah, part of what this program is that we do rotate through different products over time. Like, so each week we rotate in, and there's different products we bring in. And we actually, as we get questions or requests, like some of the products that you mentioned right here, Jane, we actually will rotate and bring on new products that we can add into the program that maybe we weren't doing before, but if there's enough questions about them, we want to bring them on as well. So yes, we do definitely rotate through. You will see different products in, and some of the products you actually mentioned in your question are ones that we'll be bringing into the PharmAssist program as we go. So that's an excellent question. These are actually some of the great questions we like, are not just specific about what we're talking about, but questions you have maybe beyond the scope of what we're talking about in any individual program. And then that gives us ideas to know how we can best meet your needs and answer the questions that you guys have out there. And with all that being said, just a reminder on what Laurel had mentioned earlier, is all of these videos, and we'll say this multiple times throughout the program, but all these videos and the individual little bite-sized products as well, they're all available on our website, as well as also on YouTube and on our Facebook page. So you can obviously wait till next week to see whatever's there live and ask more questions, and we love that too. But in the meantime, if you just want to be able to watch like a previously recorded one and see some of the questions that were asked there, you can do that as well too. So we will remind you of that again and again, even as we roll through this program. But that's an awesome question. And Laurel also, when she comes on multiple product programs, she has done other products as well in other programs where you can check out some of her previously recorded PharmAssist programs as well. So awesome question, Jane. Thanks. And glad we're able to help you through some of these different products.
And one other thing to mention about that is that if you don't want to watch the question and answer part, you can just go to the mymandelsPharmacy.com website, and you can click on the individual medications. And there are several different nurses throughout the country that have recorded the different medications, and you can just watch whichever ones you want. So you can pick out whatever you're being prescribed and just watch those videos as well. Another thing I wanted to mention is the Sonara Patch, just before we get off of the subject of that, is that when you take the patch off, you might notice that your skin is a little pale or a little pink or red, or you could have a little bit of swelling, and that's very normal. And that side effect will go away right away once you take the patch off. So it's nothing that you need to worry about. So any other questions come in, Craig?
No, that's what I was just checking. Okay. It looks like we got a lot today, ton of questions. So, and thank you to everybody, but looks like we're good right now. So as always, what we'll do is we're here. While you have Laurel on, if you have any other questions, if you want to get them in the meantime, I'm going to turn it over to you, Laurel, to begin starting to wind down and get ready to say goodnight to everybody. But if you do any questions come in the middle of that, we will certainly make sure that I get them over to Laurel so you can get an answer. But over to you, Laurel.
Okay. Well, I just super appreciate everybody listening and asking questions. And I really enjoy the back and forth. I wish I could see your faces too, because that would make it even more fun for me. But I'll just imagine that you're all just beautiful people out there. And I know that you're going to make it through this. Just take it one step at a time. And you will get through this, okay? I promise. If I can do it, so can you. So just to close, just make sure that you check out the My Mandels website. You can go to the Facebook page as well, or to YouTube, and you've got all of your videos there ready for you to watch at any time. So I just super appreciate that you were here tonight, and I wish you all good luck.
So with all that being said, I just want to say, first off, thank you so much, Laurel, for your time and your expertise tonight, your awesome answers and your candor, and you shared a lot, and we love that, and that's what we love about this program. So thank you so much for everything. Also, I want to thank everyone who joined us via Zoom and Facebook Live, all of the excellent questions that you asked, the follow-up questions. This was a great interactive program tonight, and we were able to get a lot of good, even sometimes, like we say, the follow-up questions that spark because of somebody else's question, things like that. So thank you so much for joining on tonight so that you could ask those questions. It really made this program something special. So we appreciate that. And I did say before, we were going to say it again, that do not forget all of these videos, the full VLEs or virtual learning experience videos, as well as the little bite-sized individual product videos. All of those those videos are now available. You can find them on demand. You can find them on our YouTube page. You can find them on our Facebook page. And of course, as Laurel said earlier, you can find them at the mymandelsPharmacy.com/PharmAssist page. Everything is there. You can also find those behind the shots videos. There's plenty of other great information like our Leaning on Sunshine website, where you can find other ways to interact with people going through what you're going through and find ways to get support from other people that are kind of on their own fertility journal. So there's plenty of great information on that website. It's not just these videos, but there's a whole lot more that we really want to just direct you over there and take a look, and feel free to share with us new ideas that you may have. With all that being said, we look forward to seeing everyone here again next Monday night at 7 p.m. Eastern Standard Time for another great program. If you did think that this program was helpful for you, the number one thing we can ask is to share, share, share. Please, if you have a family member, a friend, a colleague, somebody who you bump into at the local ShopRite who looks like they might be going through a fertility, now maybe not them, but everyone else, share this with them. Let them find out. It's the best way for people to find out about this program. We appreciate it, and I'm sure there's somebody out there who will appreciate it even more. And so, again, just want to say thank you so much, Laurel. Thank you, everybody at home. I had an amazing time tonight, and I look forward to the next one next Monday night. And that's it from the PharmAssist program at Mandel's. Have a great night, everybody.
Good night.